What is an attachment style and how exactly does it affect our lives? You can look at attachment style like this. It's the connection that we have to a caregiver or someone close to us that we develop in the very beginning at an early age, and either it can be healthy or unhealthy, it can be positive or negative, or it can be seen as secure or insecure attachment. Now, Mary Ainsworth's strange situation study is probably one of the best and also one of the earliest studies in this. Basically, Ainsworth did this. He took a 2-year-old and put a 2-year-old in a room with their mother, and the researchers would assess a number of things, that how the 2-year-old would react to different situations. The first bit was, how does the 2-year-old interact with their mother when they're playing with the toys? Does it interact with the mother? Do they pay attention to the mum? Then a stranger is introduced into the situation. How does the 2-year-old interact with a stranger here? Then eventually the mother gets up and leaves. How does the 2-year-old then react upon the mother leaving? And eventually after some time the mother will return, and again, how does the 2-year-old react upon the mother returning? And based on their reactions, Ainsworth was able to say if the child had a secure attachment or an insecure attachment. She said that a secure attachment was where the child wanted to interact and play with the mother, and then when the mother left, the child would become visibly distressed, and it's only upon the mother returning that it was comforted and was able to seek solace in the mum and eventually calm down. She called that a secure attachment. Then she noticed things called insecure attachments, and there were a few of those, and she categorized those in many different ways. First off, she said that an insecure attachment was categorized by either the mother being ignored by the child and the child not wanting to play with the mother, the child not caring if the mum was in the room or not, or the mum returning and the child not caring, or the child becoming visibly distressed when the mum left the room, and then when the mum returned, still visibly distressed, holding on to the mum, yet also hitting her at the same time. And from there, she created lots of different categories of insecure attachments. And essentially, it wasn't the perfect study. It didn't necessarily take into consideration cultural differences, but it was the best they had at the time, and it did really well for highlighting these categories of attachment, both insecure and secure attachment styles. Zoom a little later to age 4 and you have the Marshmallow Test. This is Walter Mischel's test. Essentially, it is a test of delay of gratification within 4-year-olds. And very simply, it is this. You have the 4-year-old sit at a table on a chair and you put a marshmallow in front of them and you say, this marshmallow is for you, you can have this. I'm going to leave the room for 10 minutes and then I'm going to return. If the marshmallow is still there and you haven't eaten it after 10 minutes, I will give you another marshmallow. In other words, you get 2. And this is a real test of delay of gratification within the child. Does the child have the ability to delay that kind of impulsive, compulsive urge for instant pleasure to get more pleasure later down the line? And what they found was some children did have the ability to delay gratification and some children didn't. The question is, why did some children have the ability to delay their gratification whilst other children didn't have the ability to delay their gratification? Now, if you remember the Ainsworth strange situation at age 2, what's really interesting is if you take the children who at age 2 were found to be insecurely attached and you put them in the Marshmallow Test, they were found to be far more likely to have a lack of delay of gratification when compared to the children who were securely attached, who were better at a delay of gratification. In other words, the insecurely attached children from age 2 were far more likely to take the marshmallow than delay their instant pleasure and gratification like the securely attached children. This is interesting because then they did a longitudinal study on this. How does the child end up as an adult based off of this delay or lack of delay of gratification at age 4? And they found that the securely attached children who had a delay of gratification were far more likely to have longer lives, earn more money, have less health problems, and reported being overall a lot happier than compared to the insecurely attached children who lacked the delay of gratification, who were far more likely to want to have instant pleasures, and they had shorter lives they reported earning less money, unhealthier, and overall less life satisfaction when compared to the securely attached children who had a delay of gratification. So we might ask ourselves, what are the key contributing factors towards a child developing a lack of delay of gratification? And there's a number of things. It mainly resides in emotional instability from an early age. This could be as a consequence of neglect or abuse. It could be big T trauma, little t trauma. But one of the most interesting variables most associated with a lack of delay of gratification from an early age is fatherlessness. It's children who grow up without a father figure in their life. And that is because the father, the masculine temperament, is responsible for the delay of gratification. See, from the very beginning, the mother is hardwired. She's hardwired to give to the child. She has a different bond with the child. She has a far stronger bond with the child. And she is pre-wired to give to the child. The father doesn't have the exact same bond. It's not that he doesn't care, but he doesn't have the exact same bond. There is a sort of almost an emotional distance. And that emotional distance can be seen as something that's quite good because they have, within that distance, the ability to say no, to critique, to delay gratification. And that's something that eventually the mother does learn and develop. This is something that the father has from the very beginning. What you find is children that grow up in a fatherless household potentially also have a lack of delay of gratification. And children who grow up with a lack of delay of gratification become adults who act more impulsively and compulsively towards instant pleasures now. You see, these are the adults that are more likely to grow up to take drugs, less likely to invest time and study, in lieu of a father figure, more likely to seek solace amongst other guys, so join gangs and things like that. Same with this impulsive, compulsive urge to earn money now, again, linked to criminality. And it's absolutely no wonder why 76% of offenders in prison have grown up in a fatherless household. So what's the takeaway from this then? Does attachment shape and affect our lives? Yes. However, are we completely powerless to it? No. We can do the work that is needed to both heal and grow from our past. We don't need to let our past define us. Otherwise, we're destined to travel a path that is predetermined 9 months before we were even born. That's interesting, isn't it? Now, again, I'd love to hear your feedback on this, what you think about this, if you've seen yourself in this, if you agree with this, if you disagree with this. What do you think about the studies as well? Always love to hear your feedback. But bye for now, and speak again very soon.